Welcome back. You're watching Change Agents, the India Social Entrepreneur 2014. The desire to bring about change amongst the poorest of Indians has often inspired many entrepreneurs to work at the grassroots. Our next two finalists belong to that league of change makers. First up, the hero of tribals, Dr. H. Sudarshan, who through his Karuna Trust is providing primary health care to the remotest areas by working through the public-private partnership route in 5 states. Also, meet Yogendra Bhushan of Bodh Shiksha Samiti, an organization that's galvanized India's ultra-poor communities to transform their villages and slums into centers of educational excellence. Let's take a look.
Dr. Sudarshan gave up the idea of pursuing a medical practice in the city to work with tribal communities. In 1980, he started Vivekanand Girijana Kalyan Kendra for the integrated development of the tribals in the Chamarjanagar district of Karnataka. And in 1986, he founded Karuna Trust, which is dedicated to rural development in the states of Karnataka, Arunachal Pradesh, Meghalaya and Manipur. So what made Dr. Sudarshan turn his back on the possibility of lucrative urban practice in favor of working with poor and tribal communities?
There were 2 factors in my life which made me to take up this type of work. First, I was born in a village in a cowshed where there were no hospital facilities. And later at the age of 12, I went with my father to a village and he literally died in my lap without medical aid. I had to helplessly watch him die. So that day I decided that I should become a doctor and save lives rather than helplessly watching people die in front of me.
Transforming dysfunctional government primary healthcare centers into professional hubs of last-mile healthcare service delivery, Karuna Trust has pioneered the public-private partnership model that brings the government, the village community and the social venture together to deliver high-quality primary healthcare to rural India. The government invests in upgrading infrastructure and pays for the efficient running of the PHCs. Karuna Trust brings in healthcare management systems and disruptive health innovations to the centers, whereas the village health councils hold their PHCs accountable for reporting higher health outcomes and functioning as zero corruption zones. And all this has been achieved despite numerous challenges.
There are operational challenges because we have accepted to work in very remote areas, hilly, tribal. And we started with work in Veerappan's territory. Now we work in Maoist areas. We also work in the northeast where insurgency is a serious problem. Human resources to get doctors is difficult, so we motivate, we do personal non-incentive and incentive for the doctors to work in remote areas. We also train Ayush doctors to do in the remote areas. Local ANMs, girls are trained as auxiliary nurse midwives. I think we should give up this idea of only MBBS doctors should do that. The concept of 3-year rural health practitioners is a very good idea, and I have been at it, and there is a now national health policy also. And we need to have more number of these 3-year focused. They are not substandard doctors, good quality rural health providers of rural primary health care.
Emerging stronger with every challenge, Karuna Trust today provides preventive, promotive, curative, rehabilitative health services, including immunization. Treating 20,000 people in hilly tribal areas and 30,000 in rural areas at its 68 primary health centers through its team of 110 doctors, 1,000 nurses, pharmacists and other paramedical workers, Karuna Trust has on its rolls over 200 Ashas as well. Sudarshan tells us that per person cost for a year comes to be 150 rupees and the government bears 90% of the cost, while Karuna Trust raises the rest through activities like ecotourism projects.
We have 3 different plans of scaling up our model. One is we ourselves, Karuna Trust itself, going and establishing branches like what we did in Northeast. We have our own office and doing it. But in Odisha, we are partnering with a local NGO, and after 3 years now the local NGO takes over and does it. And the third model is to try and do capacity building of other voluntary organizations to do similar work.
While While primary health care is free of cost, Karuna Trust charges fee for secondary and tertiary care treatments. And for treatments to reach remotest of areas where people can't come to the centres due to bad road connectivity, Karuna Trust, in collaboration with Smile on Wheels, started mobile health units that go door to door to treat patients.
ಬಡಬಗ್ಗರಿಗೆಲ್ಲ ಈ ಕಾಸ್ಟ್ಲಿ ಹಾಸ್ಪಿಟಲ್ಗಳಿಗೆ ಹೋಗಿ ಆ ಕ್ಯೂ ನಿಂತು ಅಷ್ಟು ದುಡ್ಡು ಖರ್ಚು ಮಾಡಬೇಕು ಅಂದರೆ ಅವ್ರ ಹತ್ರ ಎಲ್ಲ ಕೆಲಸ ಕಾರ್ಯ ಎಲ್ಲ ಬಿಟ್ಟು ಇಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ಕೊಂಡು ಕೂಡ ಹೋಗಿ ಹಾಸ್ಪಿಟ್ಲಿಗೆ ತೋರಿಸೋಂಥ ಜನ ಇದ್ದಾರೆ. ಎಲ್ಲ ಬಡಬಗ್ಗರು ತುಂಬಾ ಅನುಕೂಲ ಆಗಿದೆ. ಬಡಬಗ್ಗರಿಗೆಲ್ಲ ಒಂದು ಮೆಡಿಸಿನ್ ತೊಗೊಳ್ಬೇಕು ಅಂದರೂ ಹೊರಗಡೆ ಎಲ್ಲ ಬರ್ದು ಕೊಡ್ತಾರೆ ಬೇರೆ ಹಾಸ್ಪಿಟ್ಲ್ಗಳಲ್ಲೆಲ್ಲ. ಇಲ್ಲೆಲ್ಲ ಅವರೇ ಅನುಕೂಲ ಮಾಡಿಕೊಟ್ಟು ಮತ್ತು ಏನೇ ಒಂದು ಕಾಯಿಲೆ ಬಗ್ಗೆ ಒಂದು ಇದ್ರ ಬಗ್ಗೆ ಎಲ್ಲ ಬಂದು ಊರೂರಿಗೂ ಬಂದು ತಿಳಿಸಿ ವಿಷಯ ತಿಳಿಸಿ ಜನಗಳಿಗೆ ಮೂಢತನ ಎಲ್ಲ ಓಡಿಸಿ ಅವ್ರಿಗೆ ಅನುಕೂಲ ಮಾಡಿಕೊಡ್ತಾ ಇದ್ದಾರೆ.
ಸುದರ್ಶನ್ ಸಾರು ಅವರು ಅಲ್ಲಿ ಸಾಲಲ್ಲ ಸರ್, ತುಂಬಾ ಬಡವರಿಗೆ ಬಗರಿಗೆ ಎಲ್ರಿಗೂ ತುಂಬಾ ಅನುಕೂಲ ಮಾಡಿಕೊಟ್ಟಿದ್ದಾರೆ. ಅವರು ಇನ್ನೂ ಸುತ್ತು ಇರೋ ಊರುಗಳ ಜನ ಕೂಡ ಅಲ್ಲಿ ಬರ್ತಾರೆ. ಅವ್ರಿಗೆ ಇಷ್ಟೇ ನಾವು ಥ್ಯಾಂಕ್ಸ್ ಹೇಳಿದ್ರು ಹೇಳ್ಕೊಂಡ್ರು ಅವ್ರಿಗೆ ಸಾಕಾಗಲ್ಲ ಸರ್. ಅವರು
Another crusader who is galvanizing India's ultra-poor communities is Yogendra Bhushan of Bodh Shiksha Samiti, an organization that is transforming villages and slums into centers of education excellence. Bodh Shiksha Samiti community schools were launched in 1987 as the result of a unique partnership between residents of Jaipur's Gopalpuri urban slum community and a group of like-minded men and women. Today, Bodh Shiksha has both urban and rural schools and acts as a resource agency for providing training and other support for schools seeking to improve the quality of education available to underprivileged children. Reaching out to more than 20 lakh deprived children through 43 Bodhshalas and 25,000 government schools in the state of Rajasthan, Yogendra believes his idea is replicable and scalable.
We generally don't take a single textbook methods, but largely the content for educating children in different subjects we are being taken from their own life situations, from their own context. So one is that method. Second is that generally children are being given the opportunity of expressing their ideas, their thinking, their views and their ways of looking on each and every aspect which they are being generally to be taught.
By pooling common resources and unlocking government funds, families contribute land, labour and capital to set up and scale their Bodhshalas from primary to secondary levels. Students, parents and teachers partner to ensure effective school management and high education quality. As a result, Bodhshalas typically achieve 99% enrollment of male and female students and dropout rates of less than 10%. More than 90% of Bodhshala students are first-generation literates.
In next 3 years, our organization has taken the decision that let us now be mature enough in practicing this type of pedagogy in the school. So now at least we should take initiative to cover in next 3 to 5 years every district of the state, establishing such clusters of Bodhshalas in every district of there are near about 33 districts in Rajasthan. And another major work of Bodh Shiksha Samiti is with the mainstream schools.
The pedagogy of the common school model is now being grafted onto 25,000 government schools of Rajasthan and Himachal Pradesh. Additionally, 100 social ventures across 13 states have partnered with Bodh to replicate the curriculum and pedagogic breakthroughs demonstrated by Bodhshalas.
More power to Karuna Trust and Bodh Shiksha Samiti. Time for us to take another break here on Change Agents, India Social Entrepreneur 2014. But on the other side, we bring you all the action from the grand finale. We'll tell you who walked away with the top honours.